The question is that the motion be agreed to, and I call the member for Monash.
Thank you, Deputy Speaker. Whilst I disagree with some parts of what the member for Macarthur has put forward to the House today, I would never doubt his sincerity towards the issues around health and the wellbeing of his community and the community in Australia, and I applaud him for that. He asks for improvements to our health system. Well, we're clearly in desperate need of improvements, given the wave of flu, RSV and COVID currently sweeping across the nation and overwhelming the public health system. Elective surgeries have been cancelled under South Australia's emergency code yellow, with plans to transfer some patients from overwhelmed Adelaide metropolitan hospitals to regional centres, in large part because frontline workers are sick. But how can that be if they're all vaccinated? Clearly, I do not understand how vaccinations work. An improved and supportive health bureaucracy is not the experience of Chris Nemeth, a vaccine-injured gentleman who has been suffering great distress and financial hardship since he was injured by the COVID vaccine. Chris is that desperate that he's given me permission to use his full name. Chris was diagnosed with COVID vaccine injury called chronic inflammatory demyelinating pyoneuropathy, which resulted from his first dose of AstraZeneca vaccine. He will have this condition and need treatment for the rest of his life. This is the same vaccine that was removed from pharmacy shelves after its manufacturer conceded that in the United Kingdom court last month that the vaccine causes blood clots. It bewilders me that there hasn't been more of an uproar from Australians who received the vaccine, the AstraZeneca vaccine. Chris has been engaged with the government's vaccine injury compensation scheme and getting nowhere. Working with a lawyer because the system is so difficult to navigate, Chris has compiled a 1,000-page submission which he submitted to Services Australia on March 2, 2003. That's 459 days ago. In these 459 days, his application passed the initial review stage and then also passed the external medical review done by the TGA on the first try. After passing the external medical review, he was asked for additional information 3 times, and his application then went through another external legal panel review and an internal legal review. The most recent external legal review was completed on the 23rd of May, and the advice passed to Services Australia on that day. Last Thursday, day 455, Services Australia advised that they cannot offer any further update. Nothing. No indication of what the advice from the external legal panel was, no indication of the next step, and no indication of when they will be able to provide any further update. The scheme is supposed to be an easy-to-access safety net with quick administrative processes. These were Greg Hunt's, the then Health Minister's, words when he announced the scheme. The government knew there would be vaccine injuries. But this cautionary initiative was drowned out by the fear propaganda machine and the safe and effective mantra. Chris is an innocent victim of bureaucratic nightmare, and in Chris's words, the vaccine injury scheme is administered with cruelty and callous disregard for the human beings who have been injured by these vaccines that were taken in good faith when asked by our government to do so. Chris told me he speaks with other people facing the same challenges and with the scheme and its administrators. And are we seeing another robo-debt? Will it take a suicide to draw attention to this horrendous situation? Dare I say it, the vaccine compensation looks to have similar hallmarks of the robo-debt scheme, which is referred to as a crude and cruel mechanism. Haven't we learned anything as a parliament of people? Chris hasn't been able to work since September 2021 and has not had any income since April of 2022. While he did receive a modest TPD payment from his superannuation, it's money that diminishes with every passing day. Chris called me last Friday at his wit's end. He is a strong, capable and professional man who has been pushed to the brink, and he's not the only one. He said he's at the edge of his ability to cope with the additional harm that this claim scheme inflicts upon him every day. Chris's situation is a shameful blight on our nation, one that has not reached its zenith.